Welcome to Physiomobility's Total Hip Replacement Exercise Program for Week 1. For the warm-up section, please repeat each movement 5 times before proceeding to the exercise section. For the first movement, take a deep breath as you reach your arms up towards the ceiling. If you can't reach all the way overhead, reach as high as you can go. You want to reach while taking a deep breath and opening up the chest as much as you can. For this next movement, you want to squeeze your glutes as much as possible while pushing your heels down into the floor firmly. Squeeze, hold for a couple seconds, and then relax. For the last warm-up exercise, we're going to be lying down on our back, focusing on ankle pumps, pushing through the toes to point down towards the floor and flex back up towards the ceiling. Now we're moving on to the exercise portion of this program. For this first movement, make sure that the towel is gripped firmly behind the thigh so that you have absolute control over the movement as it bends and flexes towards the body and away from it. For this next movement, make sure you're pushing your entire leg down by using your glutes and keeping the leg as straight as possible. You want to drive your heel down towards the towel. For the second exercise, make sure that you're squeezing your thigh muscles and pressing the knee down into the towel and relax. You really want to make sure that the movement is coming from the thigh and not your entire leg. For this next exercise, we are repeating the same movement, except first you are going to slightly move your leg to the outside, abducted, and then press the knee down into the towel, once again only using the thigh muscle. Keeping your leg straight and have the strap around your ankle, you will slightly lift your foot off the towel and abduct to the outside of your body, using your towel to help guide your leg back to midline and back again outside. Using your non-operated leg, grab underneath the thigh and pull your knee towards your body. You want to keep your hip down of your operated leg and squeeze your glute to feel a stretch in the front of your right hip. Please try and keep your leg as straight as possible. Using the chair for balance, bend your operated leg up till 90 degrees and then relax back down. You want to take your time through this and really squeeze in through the hamstring and the glutes of the operated leg. Using your operated leg, flex your knee and your hip up to 90 degrees and relax back down. Have a chair or support beside you to help with balance, and take your time as you bring your knee up towards hip height and relax back down. For this calf stretch, you want to place your toes on a higher object, whether that be a step or a stool. Keeping your heel pressed on the ground, you're going to keep your leg completely straight and push your hips forward so that you feel a stretch behind the calf and in the hip as well. Now in a standing position, holding the back of a chair, slide your leg outwards as much as possible and back in. Make sure not to tilt the torso. For the next movement, we're repeating a similar motion except sliding our foot backwards and while maintaining that upright torso position. For this exercise, make sure that your hips are up on a higher surface so they're not lower than 90 degrees. You can do so by placing a foam or an object on top of the chair that you're sitting on if it is at hip height. From there, placing your leg in front of you, you want to gently stand up and push the hips back to sit back down. For this next movement, we're going to gently step forward and step backwards with our operated leg, taking a pause in the middle in between each step. For this next movement, we're gently going to be shifting our weight side to side, going up on the toes, or if you feel comfortable, gently lifting your foot slightly off the ground and keeping your legs as straight as possible. This is so that your hips can get used to the new weight bearing. Use an extra support, such as a kitchen counter, to help you gently step side to side. After you've completed 10 repetitions of each exercise, make sure to go through this routine one more time and talk to your therapist if any new problem develops.